The African Health Workforce Project put together an information system with the Kenyan regulatory boards, that is the groups that license professional healthcare workers. And with that, they contain all the data on every healthcare worker in the country. We can now determine people that are practicing illegally, for example, may not be properly trained. Kenya can better inspect training schools and be sure that they are teaching the right curriculum to people. And with that, Kenya is well on its way to having plenty of nurses to help them reach their goal of universal health care for all. About 80% of that workforce, the professionals providing that care and treatment, are still being paid by PEPFAR dollars. So the project is looking for ways to make that care more efficient, to enable Kenya to be able to take over those programs using ways that they can afford. We are looking at this thing called task sharing, which means that lower cadres of healthcare professionals, even community health workers, can provide some of the care at far less cost. There's a tremendous potential for replicating this project in other countries. In fact, we've done that in one country, in Zambia, using what's called a South-to-South approach. That is, not just bringing Americans over at a very high cost to put this in place, but rather using our Kenyan team to put the program in place in other countries. So that's the South-to-South approach. We did that very successfully in Zambia, and we'd very much like to do that in other countries.